You've probably heard this before. Lower your blood pressure, cut back on salt, exercise more, try to relax. And those things matter, they absolutely do. But here's what most people don't realize. You can do all of those things perfectly, eat clean, walk every day, meditate, even take your medication as prescribed, and still walk into your doctor's office with a blood pressure reading that makes no sense to you. 140/90, or 135/85. Or maybe it's crept up over the last year from 120 to 130, and now your doctor is mentioning the word hypertension with that concerned look. And you think to yourself, how? I'm doing everything right. That confusion, that quiet frustration is incredibly common. And it's not your fault, because the conversation about blood pressure has been missing something important. We've been taught to think about it like a math problem. Eat less of this, do more of that, and if those numbers don't move down, well, then it must be genetics or aging or bad luck. But here's the truth that changes everything. Your blood pressure isn't just a number that goes up when you eat poorly and goes down when you eat well. It's a real-time reflection of how your body is managing tension inside your blood vessels, moment by moment, hour by hour, often in ways you've never been shown. And that brings me to something I want you to consider. What if 3 simple, quick techniques, things you could do in less than 2 minutes each, could start moving those numbers down without adding more pills to your morning routine? Not because they're magic, not because they replace what your doctor has prescribed, but because they work with your body's natural design in a way that most of us have never been taught. I'm Dr. Narges, and on this channel we talk about real, practical, evidence-based ways to protect your health as you age. Not fear, not hype, just clear medical insight that helps you make better decisions. And today we're talking about 3 quick techniques to help lower blood pressure, explained by a cardiologist. But not in the way you might expect, because the first technique isn't about what you eat, the second isn't about how much you exercise, and the third has almost nothing to do with medication. So let me ask you something honestly. When was the last time you checked your blood pressure at home? And when you saw that number, did you actually believe it? Or did you wonder if maybe you did something wrong? Like you had just walked up the stairs, or you were thinking about a stressful email, or you hadn't sat still long enough? That doubt is everywhere, and it matters more than most people realize. Here's what I want you to understand by the end of this video. Your blood pressure is not a fixed thing. It's not like your height or your shoe size. It changes constantly throughout the day, based on signals your body is sending and receiving without you ever noticing. And the 3 techniques I'm going to show you target the specific moments when your blood pressure is most likely to creep up. Not because something is broken inside you, but because your body is responding exactly the way it was designed to respond. The problem is, that design worked perfectly for a very different world. A world where we moved constantly, where stress came in short bursts followed by long recovery, and where we never sat in chairs for 9 hours a day looking at screens. Today, that same brilliant design is working against us in ways we can't see, and that's what we're going to uncover together. So before we get into the 3 techniques, I want you to do something simple. Just notice how you're sitting or standing right now. Are your shoulders slightly lifted? Is your jaw gently clenched? Are you holding your breath just a little? Not fully, but just enough that you haven't taken a complete, easy exhale in the last minute or so? Most people are. And that tiny pattern, repeated 10,000 times a day, is quietly telling your blood vessels to stay slightly tighter than they need to be. That's not a failure on your part. That's just a habit. And habits can be changed when you know what to look for. That's what today is really about. Not adding more to your to-do list, not making you afraid of a number on a monitor, but giving you back a sense of clarity and control over something that affects nearly every part of your long-term health. Because here's the quiet truth that doesn't get said enough. Lowering blood pressure isn't just about avoiding a heart attack or a stroke, although those are incredibly important reasons. It's also about how you feel every single day. The fatigue that creeps in by mid-afternoon, the subtle heaviness in your chest when you're stressed, the way your sleep isn't quite as deep as it used to be. All of those things are connected to how hard your heart has to work just to push blood through your body. And when you lower your blood pressure, even by a few points, you're not just changing a number in a chart. You're changing how your entire cardiovascular system feels moment to moment. So stay with me, because the first technique is something you can start using literally today, in the next 5 minutes, without any equipment, without any special training, and without anyone even knowing you're doing it. And it works because it targets the one part of your blood pressure that most people completely ignore. We'll get there in just a moment. But first, let me show you why the usual advice often fails, and what your body has been trying to tell you all along. Let me ask you something. When you think about high blood pressure, what comes to mind? For most people, it's salt. It's the classic warning: eat less sodium and your numbers will go down. And there's truth to that. For some people, salt sensitivity is a real factor. But here's what the conversation usually misses. Salt isn't the whole story. In fact, for many people, cutting salt makes only a small difference, maybe 2 to 5 points on that top number. Important, yes, but not the game changer people hope for. Then there's exercise. We hear it all the time. Just walk 30 minutes a day. And again, that's excellent advice. Regular movement strengthens your heart, improves circulation, and over time can lower blood pressure meaningfully. But here's the overlooked problem. What about the other 23.5 hours of your day? What about the hours you spend sitting at a desk, driving in traffic, standing in line, or lying in bed trying to fall asleep while your mind races through tomorrow's to-do list? This is where the common understanding of blood pressure falls apart. We've been taught to think about it like a diet problem or an exercise problem. But blood pressure is actually a nervous system problem. And until you understand that, you'll keep chasing small changes while missing the biggest lever of all. So let me explain what I mean. Your body has 2 main branches of its autonomic nervous system. One is called the sympathetic nervous system. That's your fight or flight response. It evolved to help you run from danger, to tense your muscles, to sharpen your focus, and yes, to raise your blood pressure so that blood flows faster to your large muscle groups. The other branch is the parasympathetic nervous system. That's your rest and digest response. It calms things down. It lowers your heart rate, relaxes your blood vessels, and tells your body that you're safe. Here's the problem most people don't realize. In modern life, your sympathetic nervous system, that fight or flight response, gets activated constantly. Not by lions or bears, but by emails, by news alerts, by traffic, by the little frustration of a slow internet connection or a conversation that didn't go the way you hoped. Each one of those moments triggers a tiny spike. Your blood pressure goes up for a few seconds or a few minutes, and then, ideally, it comes back down. But here's the hidden mechanism that changes everything. When these small spikes happen hundreds of times a day, day after day, your body starts to lose its ability to fully relax between them. It's like a thermostat that never quite turns off. Your baseline blood pressure starts to creep up, not because anything is broken, but because your nervous system has learned to stay slightly alert all the time. And your blood vessels respond by staying slightly constricted all the time. Now, most people believe that high blood pressure is primarily about clogged arteries or stiff vessels. And yes, those things matter over the long term. But before any of that happens, before any plaque builds up, before any permanent damage occurs, there's something much simpler at play. Your blood vessels have a thin layer of smooth muscle around them. That muscle can tighten or relax. When it tightens, your blood pressure goes up. When it relaxes, your blood pressure goes down. And that tightening and relaxing is controlled almost entirely by your nervous system. So here's the insight that most people miss entirely. Lowering your blood pressure isn't just about what you put into your body. It's about sending a clear signal to your blood vessels that it's safe to relax. And that signal comes from one place: your breathing, your posture, and your awareness. Let me give you an example that might feel familiar. Have you ever had your blood pressure taken at the doctor's office, and it came back higher than expected? Maybe the nurse said, "Oh, it's probably just white coat syndrome. You're nervous." And you thought, But I don't feel nervous. That's the thing. You don't have to feel anxious for your sympathetic nervous system to be activated. Just walking into a medical office, sitting on that crinkly paper, knowing someone is about to put a cuff on your arm, that's enough to trigger a subtle, almost invisible stress response. Your blood pressure goes up 5, 10, sometimes 15 points without you ever feeling a thing. Now imagine that same pattern happening throughout your day. Not because you're afraid, but because your body is responding to the ordinary friction of modern life. That's not a medical condition. That's a design feature of your nervous system. And once you understand that, you stop blaming yourself and start working with your body instead of against it. Here's another common misunderstanding. Many people believe that if their blood pressure is high, they'll feel it. They expect headaches or flushing or a pounding heart. But the truth is, for the vast majority of people, high blood pressure has no symptoms at all. You can walk around with a pressure of 160/90 and feel perfectly fine. That's why it's often called the silent killer. Not because it's dramatic, but because it's quiet. It doesn't announce itself. It just slowly, steadily puts extra strain on your heart, your kidneys, your eyes, and your blood vessels over years and decades. And that silence creates a strange psychological trap. Because if you don't feel bad, it's hard to stay motivated to make changes. The consequences feel distant, abstract. But here's what I want you to understand. Every time your blood pressure is elevated, even if you don't feel it, your heart is working harder. Your arteries are being pushed a little more. And over time, that wear and tear adds up. But, and this is the hopeful part, the opposite is also true. Every time you lower your blood pressure, even by a few points, you give your cardiovascular system a break. You reduce the workload on your heart. You let those tiny, smooth muscles in your artery walls relax, and you create a little more room for your blood to flow easily. So the question becomes, how do you do that without adding another complicated routine to your already busy day? How do you lower your blood pressure in a way that fits into real life? Not a wellness retreat or a meditation retreat or a month-long cleanse. That's what the 3 techniques are about. They're not about overhauling your entire lifestyle. They're about identifying the specific moments in your day when your blood pressure is most likely to drift upward, and then using quick, targeted interventions to bring it back down. But before we get to those techniques, I need to show you one more thing. I need to show you why timing matters. Because most people check their blood pressure at the wrong time of day, in the wrong position, and with the wrong expectations. And that leads to confusion, frustration, and sometimes even unnecessary medication. So let me walk you through a real-world pattern that I've seen hundreds of times in my practice. Because once you see it, you'll understand why the first technique works the way it does. Let me tell you about someone I'll call Susan. And as I describe her, I want you to notice if any of this sounds familiar. Susan is 57 years old. She works as an office manager. She's not someone who ignores her health. In fact, she's quite careful. She tries to eat a balanced diet. She takes a walk most evenings after dinner. She sees her primary care doctor every year for a checkup. And for years, her blood pressure was fine. 120/75. Sometimes 118/70. Nothing to worry about. But over the last 2 years, something changed. Her numbers started creeping up. First to 125/80, then to 130/82. And at her most recent visit, she got a reading of 138/86. Her doctor mentioned that she was now in the elevated range, sometimes called prehypertension, and suggested she watch her salt intake and try to exercise more. Susan left that appointment feeling confused and a little defeated because she didn't feel any different. She hadn't changed her diet, she was already walking, and yet her numbers were climbing. She started checking her blood pressure at home, and that's when things got even more confusing. Some mornings she'd get a reading of 132/84. Other mornings, 124/79. In the evenings, sometimes her numbers looked perfectly normal. Other evenings, they'd be even higher than at the doctor's office. She started wondering if her home monitor was broken. She bought a new one. Same thing. She wondered if she was doing something wrong with the cuff. She watched videos, read instructions, made sure her arm was at heart level. Still, the numbers bounced around, up and down, back and forth. No clear pattern. Now, here's what Susan didn't know. And here's what most people never get told. Her blood pressure wasn't broken. It wasn't random. It was responding perfectly to the hidden rhythms of her day. And once we looked closer, the pattern became obvious. Susan's morning routine started with an alarm clock that jolted her awake. She'd sit up quickly, swing her legs out of bed, and walk straight to the kitchen to make coffee. She'd drink that coffee while scrolling through her phone, checking emails that had arrived overnight, many of which required answers before her first meeting. Then, she'd rush to get ready, often holding her breath slightly as she zipped up her clothes or brushed her teeth, a tiny tension she never noticed. By the time she sat down to check her blood pressure, usually about 30 minutes after waking, her body had already been in a low-grade stress response for nearly an hour. No wonder her numbers were elevated. But the real insight came when we looked at the rest of her day. Susan spent 8 hours at a desk, mostly sitting. And here's something fascinating. When you sit for prolonged periods, especially in a slightly hunched position, your diaphragm doesn't move as freely. Your breathing becomes shallower, and your body interprets that shallow breathing as a signal that something might be wrong. Not consciously, but deep in your nervous system, shallow breaths trigger a subtle alert. Your sympathetic nervous system stays more active than it needs to be. Your blood vessels stay slightly constricted, and your blood pressure stays a few points higher than it would be if you were standing or moving. Susan had no idea this was happening. She thought sitting was neutral, neither good nor bad for her blood pressure. But the way she sat, combined with the stress of her work, was quietly keeping her numbers elevated for hours at a time. Then there was the evening. Susan would come home tired. She'd make dinner, eat while watching television, and then sit again until bedtime. In the hour before sleep, she'd often replay the day's stressful moments in her mind. That conversation with her boss, that email from her mother-in-law, that thing she forgot to do. Her mind was busy and her body was listening. Even though she was physically resting, her nervous system was still in a mild state of alert. Her blood pressure would often be higher at 10 o'clock at night than it was at 2 in the afternoon. Susan is not unusual. She's not doing anything wrong. She's living a normal life in a world that was not designed for cardiovascular calm. And her blood pressure was simply reflecting that reality. But here's what gives me hope, and what I want you to feel as well. Once Susan understood the pattern, everything changed. She didn't need a complete life overhaul. She didn't need to quit her job or move to a remote cabin in the woods. She just needed to learn 3 quick techniques that targeted the specific moments when her blood pressure was most vulnerable. The first technique addressed her morning rush. The second targeted her long hours of sitting. And the third gave her a way to reset her nervous system before bed. None of them took more than 2 minutes. None of them required any special equipment. And within 2 weeks, her home blood pressure readings started to change. Not dramatically at first, but consistently. 132 became 128. 128 became 124. And Susan started to feel something she hadn't felt in years. She felt in control. Now, I want to be very clear about something. Susan was not someone with advanced hypertension. She didn't have heart failure or kidney disease or a history of stroke. Her blood pressure was elevated, not dangerous. And the techniques I'm about to share with you are not a substitute for medical treatment. If your doctor has prescribed medication, please keep taking it. If you have very high blood pressure, please follow your doctor's advice first. These techniques are tools. They work alongside good medical care. They are not replacements for it. But for the millions of people whose blood pressure is creeping up, who are in that gray zone between normal and hypertensive, who are tired of being told to just relax or just eat better or just exercise more, these techniques offer something different. They offer a way to work with your body's own design, to send clear signals to your nervous system that it's safe to let go, to lower your blood pressure not by fighting against your body, but by cooperating with it. So let me ask you to think about your own day for a moment. When does your blood pressure tend to be highest? Is it in the morning like Susan? Is it during work hours? Is it in the evening when you're trying to wind down? Or maybe you've never checked it enough to know. That's okay. What matters is that you're here, you're curious, and you're ready to understand something new. Because the 3 techniques I'm about to teach you are not complicated. They're not time-consuming, and they're not expensive. They are, however, specific. They target the exact mechanisms that most people overlook. And they work because they address the real cause of most mild to moderate blood pressure elevation. Not salt, not lack of exercise, but a nervous system that has forgotten how to fully relax. In the next part, I'm going to walk you through exactly what happens inside your body when your blood pressure goes up. Not in a dry, textbook way, but in a way that helps you see the invisible chain of events that connects your daily habits to those numbers on the monitor. Because once you see that chain, you'll understand exactly why each technique works. And more importantly, you'll know how to use them in a way that fits your real life, not some idealized version of it. Now let's go inside your body. Because once you see what's actually happening, the 3 techniques I'm going to share with you will make perfect sense. They won't feel random or like just another set of wellness tips you try for a week and then forget. You'll understand the why behind each one. And that understanding is what turns a technique into a lasting habit. So let's start with the blood vessel itself. Imagine a garden hose. When the hose is wide open and flexible, water flows through easily. There's very little pressure building up inside. But if you pinch that hose with your fingers, suddenly the water has to push harder to get through. The pressure inside the hose rises. That's exactly what happens in your arteries. When your blood vessels are relaxed and open, your blood pressure stays lower. When they tighten or constrict, your blood pressure goes up. Now, what controls that tightening and relaxing? In your garden hose, it's your fingers. In your body, it's a thin layer of smooth muscle that wraps around each artery. That smooth muscle is connected to your nervous system. When your sympathetic nervous system, your fight or flight response, is active, it sends a signal to that smooth muscle saying, "Tighten up, get ready." And the muscle obeys. Your vessels constrict, your blood pressure rises. When your parasympathetic nervous system, your rest and digest response, is active, it sends the opposite signal. Relax, let go, we're safe. The smooth muscle listens. Your vessels open wider, your blood pressure drops. This exchange happens constantly throughout your day. Every time you feel a moment of stress, your sympathetic nervous system activates. Every time you truly rest, your parasympathetic nervous system takes over. Your blood pressure moves up and down like a wave, responding to your internal state. Here's where the hidden mechanism comes in. Most people believe that stress has to feel like anxiety or panic to affect their blood pressure, but that's not true. Your sympathetic nervous system can activate at very low levels you never consciously notice. A slightly furrowed brow, a shallow breath, a held jaw, a hunched posture. These tiny physical signals are enough to tell your nervous system, something's wrong, stay alert, and your blood vessels respond by staying slightly constricted. Now let me show you how this plays out in 3 everyday scenarios. Because once you recognize these patterns in your own life, you'll see exactly where the opportunities for change are. Scenario 1, the morning alarm. When you wake up suddenly to a loud noise, your body releases a surge of stress hormones like cortisol and adrenaline. That's a normal part of your circadian rhythm. Your body is designed to become more alert in the morning. But if you combine that natural morning surge with a jarring alarm, a quick sit-up, and then immediately checking stressful emails or news, you're adding fuel to the fire. Your sympathetic nervous system goes into overdrive before you've even had a chance to drink water. Your blood vessels constrict, your blood pressure rises, and if you measure it within that first hour, you get a reading that doesn't reflect your true baseline. It reflects your body's morning stress response. Scenario 2. Prolonged sitting. When you sit for more than 20 or 30 minutes, especially in a chair that doesn't support good posture, something interesting happens. Your diaphragm, the large muscle beneath your lungs that helps you breathe, can't move as freely. Your rib cage becomes slightly compressed. As a result, your breaths become shallower. You take in less air. You exhale less carbon dioxide. Your body interprets this shallow breathing as a mild threat. Not enough to make you feel panicked, but enough to keep your sympathetic nervous system partially activated. Your blood vessels stay slightly constricted. Your blood pressure stays a few points higher than it would be if you were standing or walking. And here's the kicker, you won't feel it. You'll just feel normal. But normal in this case means elevated. Scenario 3, evening wind down. After a long day, you finally sit down to rest. But your mind is still replaying the day's events. That conversation with your coworker, that bill you forgot to pay, that thing your teenager said. Your body doesn't distinguish between a real threat and a remembered one. When you mentally rehearse a stressful moment, your nervous system reacts as if it's happening right now. Your sympathetic nervous system activates. Your blood vessels constrict. Your blood pressure rises. And then you wonder why you can't fall asleep, or why you wake up at 3 in the morning with your heart racing. Your body is still in fight or flight mode, even though you're lying still in a dark room. Now let me connect these scenarios to a deeper mechanism that most people have never heard of. It's called baroreceptor sensitivity. Baroreceptors are tiny pressure sensors located in your carotid arteries, the big vessels on either side of your neck, and in your aorta. Their job is to detect changes in blood pressure and send signals to your brain to adjust things in real time. If your blood pressure goes up, your baroreceptors tell your brain to lower it. If your blood pressure goes down, they tell your brain to raise it. It's an elegant, automatic feedback loop. But here's what happens over time. When your blood pressure is frequently elevated, even mildly elevated, your baroreceptors become less sensitive. They get used to the higher pressure. They stop sending those corrective signals as effectively. Your brain no longer gets the message to lower your blood pressure, and so your baseline creeps up. This is one reason why high blood pressure tends to get worse over time if left unaddressed. Your body's own pressure regulating system becomes desensitized. The good news is that baroreceptor sensitivity can improve. When you lower your blood pressure consistently, even by small amounts, your baroreceptors start to wake up again. They become more sensitive. They do their job better. And that creates a positive cycle. Lower pressure leads to better regulation, which leads to even lower pressure. So where do the 3 techniques fit into all of this? Each one targets a specific part of this hidden mechanism. The first technique works directly on your baroreceptors, using your own breathing to reset your pressure regulation system in under 2 minutes. The second technique addresses the postural and breathing patterns that keep your sympathetic nervous system partially activated all day long. And the third technique gives you a way to consciously shift from sympathetic to parasympathetic dominance, even when your mind is racing. Before I reveal those techniques, I want to acknowledge something. If some of what I've described sounds familiar, if you recognize yourself in Susan's story or in the 3 scenarios, please know that this is not a personal failure. You have not been lazy or careless. You have been living in a world that constantly triggers your sympathetic nervous system, and your body has been responding exactly as it was designed to respond. The goal here is not to blame yourself. The goal is to understand the mechanism so clearly that you can begin to work with it, not against it. In the next part, I'm going to share the 3 insights that most people miss about their own blood pressure. And then I'm going to give you the 3 techniques themselves. No fluff, no filler, just clear, actionable, evidence-based tools that you can start using today. But before we get there, I want you to take one deep breath. Not because it's a technique yet, just because you've been learning a lot and your body deserves a moment to absorb what we've covered. Ready? Let's continue. Now we arrive at the heart of everything we've been building toward, the 3 insights most people miss, and then the 3 techniques themselves. Before I share them, I want to set the right expectation. These are not complicated. They don't require special apps, expensive devices, or hours of practice, but they are specific. And their power comes from understanding not just what to do, but when to do it and why it works. So let's start with the insights, because without them, the techniques are just random actions. With them, they become tools you'll use for life. Here's the first insight that most people miss. Your blood pressure is not a static number. It's a dynamic, flowing measurement that changes with every breath, every thought, every shift in posture. Most people check their blood pressure once a day or once a week, and they treat that single number as if it's the truth about their cardiovascular health. But that number is just a snapshot. It's one frame from a movie that runs 24 hours a day. If you check your pressure at the wrong time, right after waking, right after eating, right after a stressful call, you might get a reading that is 10 or 15 points higher than your true average. And if you base decisions on that single high reading, you might end up worrying unnecessarily, or even asking for medication you don't need. The opposite is also true. If you only check your blood pressure when you're feeling calm and relaxed, you might get a falsely low reading and miss the fact that your pressure is spiking throughout the day. The insight here is simple but powerful. You need to understand your blood pressure pattern, not just your blood pressure number. And that understanding starts with checking at the same times each day, under the same conditions, and looking for trends over weeks, not individual readings. Here's the second insight. Most of the things that raise your blood pressure are invisible to you. You don't feel your blood vessels constricting. You don't feel your sympathetic nervous system activating. You don't feel your baroreceptors becoming less sensitive. All of this happens below the level of your conscious awareness. And because you can't feel it, you assume it's not happening. This is why so many people are genuinely surprised when they get a high reading at the doctor's office. They think, but I feel fine. Feeling fine and having healthy blood pressure are not the same thing. You can feel completely normal while your arteries are under silent strain. The insight here is that you cannot rely on how you feel to tell you how your blood pressure is doing. You have to measure it. And more importantly, you have to learn the hidden triggers that affect it even when you feel perfectly calm. Here's the third insight, and this one changes everything. Lowering your blood pressure is not primarily about forcing your body to do something it doesn't want to do. It's about removing the hidden signals that are telling your body to keep your pressure high. Think about that for a moment. Your body is not your enemy. Your blood vessels are not trying to hurt you. They are responding to signals. If those signals say, be alert, be ready, something might be wrong, your vessels will constrict. If those signals say, we are safe, we can rest, everything is fine, your vessels will relax. The techniques I'm about to share with you are not about fighting your body. They're about changing the signals you're sending. When you send the right signals, your body will naturally do what it already knows how to do. Lower your blood pressure on its own. So let me give you those signals. Let me give you the 3 techniques. The first technique is called the 2-minute baroreceptor reset. Remember those pressure sensors in your neck? They respond to changes in pressure inside your carotid arteries. And here's something fascinating. When you breathe in a specific pattern, you create tiny changes in pressure inside your chest and neck. Those changes stimulate your baroreceptors. And when your baroreceptors are stimulated, they send a strong signal to your brain saying, lower the pressure. It's like pressing a reset button on your blood pressure regulation system. Here's how you do it. Sit comfortably with your back supported. Place one hand on your chest and the other on your belly. Close your eyes if that feels comfortable. Now, breathe in slowly through your nose for 4 seconds. Not a huge forced breath. Just a gentle, easy inhale. Then, hold that breath for 2 seconds. Just 2, not longer. Then, breathe out slowly through your mouth for 6 seconds. Make the exhale longer than the inhale. That's the key. The longer exhale activates your parasympathetic nervous system. It tells your body, we are safe. We can relax. Repeat this pattern for 2 minutes. Inhale for 4, hold for 2, exhale for 6. That's it. You can do this while sitting at your desk, while waiting for an appointment, while lying in bed before sleep. What you'll notice after 2 minutes is a sense of calm. Your shoulders might drop, your jaw might unclench. And if you were to check your blood pressure immediately after, you would often see a drop of 5 to 10 points. Not because you did anything magical, but because you finally gave your baroreceptors the signal they've been waiting for. Now here's the insight that makes this technique powerful. You don't have to wait until your blood pressure is high to use it. In fact, it works best when you use it proactively. If you know you have a stressful meeting at 10 o'clock, do the 2-minute reset at 9:50. If you know you tend to get a high reading at the doctor's office, do the reset in the waiting room. If you wake up and feel that morning rush, do the reset before you even get out of bed. You are not reacting to high pressure. You are preventing it. The second technique is called the posture release. Remember what we learned about prolonged sitting and shallow breathing? This technique directly counteracts that pattern. Every hour, or whenever you've been sitting for more than 20 minutes, take 60 seconds to do the following. First, stand up. Just standing alone changes the pressure dynamics in your body. Second, place your hands on your lower back, fingers pointing down, palms pressing gently into your back muscles. Third, lean back slightly, opening your chest and lifting your sternum toward the ceiling. Take 3 slow, full breaths in this position. Then, reach your arms overhead, interlace your fingers, and turn your palms upward as if you're trying to push the ceiling away. Take 3 more slow breaths. Then, let your arms fall to your sides, close your eyes, and take 3 final breaths while standing quietly. What you're doing here is mechanically reversing the hunched, compressed posture that keeps your sympathetic nervous system partially activated. By opening your chest, you allow your diaphragm to move freely. By standing, you change the pressure signals traveling from your legs to your heart. By breathing slowly, you reinforce the relaxation signal. This entire sequence takes 1 minute, and if you do it every hour during your workday, you will prevent hours of accumulated vascular tension. You won't just feel better. Your blood pressure will actually be lower at the end of the day than it would have been otherwise. The third technique is called the evening reset. This one is for the hours before bed, when your mind wants to replay the day's stress even though your body needs to rest. Lie on your back on your bed or on a yoga mat. Place one hand on your belly and the other on your heart. Close your eyes. Now, instead of focusing on your breathing, focus on a single word. Choose a word that feels calming to you. It could be peace, or calm, or safe, or easy. It could be a word from a language that matters to you. It could even be a simple sound like om or ah. The word itself doesn't matter. What matters is that you repeat it silently on every exhale. Breathe normally. Don't control your breath. Just let it flow naturally. And on each exhale, repeat your words silently in your mind. Inhale naturally. Exhale and say your word. Inhale. Exhale and say your word. Do this for 5 minutes. What you're doing here is giving your racing mind a gentle anchor. Instead of replaying the day's stress, Your mind has one simple thing to do. Say the word on each exhale. This technique works because it shifts your brain from the default mode network, the part that ruminates and worries, to a state of focused relaxation. And as your mind relaxes, your nervous system follows. Your parasympathetic system activates. Your blood vessels relax. Your blood pressure drops. Now, here's the most important thing I can tell you about these 3 techniques. They are not a checklist. You don't need to do all 3 every day to see benefit. Choose the one that speaks to your biggest challenge. If your mornings are chaotic, start with the baroreceptor reset. If you sit all day, start with the posture release. If your evenings are restless, start with the evening reset. Master one. Let it become automatic. Then add another. And remember what Susan learned. Her blood pressure didn't change overnight, but within 2 weeks of using these techniques consistently, her morning readings dropped from 132 to 124. Her evening readings became more stable, and she stopped feeling confused and defeated by her own body. She started feeling like she had a toolkit, not a cure, not a miracle, just a set of simple, effective tools she could reach for whenever she needed them. You have that same ability. Your body is not broken. Your nervous system is not failing you. It's just been receiving the wrong signals. Now you know how to change those signals. Now you know what to do. In the final part of this video, I'm going to bring everything together. I'll show you how to fit these techniques into a real week, how to track your progress without becoming obsessive, and most importantly, how to hold all of this with the right mindset, one of curiosity, not fear. Because the goal is not to become perfect. The goal is to become a little bit wiser about the body you live in every single day. So let's take a step back now. Let's breathe, and let's look at everything we've covered together. We started with a question that I think haunts a lot of people. Why is my blood pressure creeping up even though I'm doing everything right? And we answered that question not with more rules or restrictions, but with a deeper understanding of how your body actually works. We learned that blood pressure isn't just about salt or exercise or medication. It's about your nervous system. It's about the invisible signals you send to your blood vessels hundreds of times a day. It's about posture, breathing, and the quiet habits you never think about. We met Susan, whose story I've seen reflected in so many of you. Someone careful, someone trying, someone confused by numbers that seem to have a mind of their own. And we saw how her blood pressure wasn't random at all. It was responding perfectly to the hidden rhythms of her day. The morning rush, the hours of sitting, the evening mental replay. Once she saw the pattern, she stopped fighting herself and started working with her body. Then we went inside the mechanism. We talked about that thin layer of smooth muscle around your arteries, the one that tightens or relaxes based on signals from your nervous system. We talked about baroreceptors, those tiny pressure sensors in your neck that can become less sensitive over time. And we saw that lowering your blood pressure isn't about forcing your body to do something it doesn't want to do. It's about removing the hidden signals that are telling your body to keep your pressure high. And then we got practical. 3 techniques. Simple, quick, no equipment required. The 2-minute baroreceptor reset for mornings and stressful moments. The posture release for long hours of sitting. The evening reset for quieting a racing mind before bed. Each one targets a specific part of the hidden mechanism we uncovered. Each one takes less than 2 minutes, and each one gives your body a clear, unmistakable signal that it's safe to relax. Now, let me be honest with you about something. These techniques are not magic. They will not work if you do them once and expect your blood pressure to be perfect forever. Your blood pressure got to where it is over months and years of accumulated patterns. Changing those patterns takes consistency, not perfection, not heroism, just small, repeated actions that add up over time. So let me give you a practical framework for the next 30 days, a way to turn these techniques into habits without feeling overwhelmed. Week 1. Just observe. Don't try to change anything yet. Keep your normal routine, but pay attention to your body. Notice when your shoulders are tight. Notice when you're holding your breath. Notice when you sit for more than 30 minutes without moving. Notice how you feel in the morning versus the evening. You don't need to write anything down unless that helps you. Just observe with curiosity, not judgment. This week is about gathering data, about seeing your own patterns for the first time. Week 2. Choose one technique, just one, the one that feels most relevant to your biggest challenge. If mornings are your hardest time, choose the baroreceptor reset. If you sit at a desk all day, choose the posture release. If evenings are when you feel most tense or have trouble sleeping, choose the evening reset. Do that one technique every day for 7 days. Don't worry about the others. Don't worry about doing it perfectly. Just do it. Even if you forget sometimes, that's fine. Start again the next day. Week 3. Add a second technique. By now, the first one should be starting to feel more natural. You might even find yourself doing it automatically. So add the second technique that addresses your next biggest challenge. Continue doing the first one. Now you have 2 small anchors in your day. 2 moments where you pause and send a relaxation signal to your body. Week 4. Add the third technique. By the end of the month, you'll have a complete toolkit. A 2-minute reset for mornings, a 1-minute posture release for work hours, a 5-minute evening practice for sleep. And here's what you'll likely notice. Your blood pressure readings will become more stable. The wild swings will smooth out. Your morning numbers will be closer to your evening numbers. And if you check your pressure at the doctor's office, it won't spike as high because your nervous system will have learned a new baseline. But here's something even more important than the numbers. You'll feel different. Not dramatically different. Not like a new person, but subtly different. Calmer. More in control. Less at the mercy of your own body. And that feeling, that sense of quiet agency, is worth more than any single blood pressure reading. Now, I want to address something that might be on your mind. What if you're already on blood pressure medication? These techniques are not a replacement for your medication. Please do not stop taking anything your doctor has prescribed. But these techniques can work beautifully alongside medication. In fact, many people find that as they practice these techniques consistently, their blood pressure becomes better controlled, and sometimes their doctor is able to adjust their medication dose downward. That's a conversation to have with your physician, but it's a wonderful possibility. What if you've tried breathing exercises before and they didn't work? I understand that. Many people have tried generic advice to just breathe deeply and found that it did nothing for them. That's because generic advice doesn't address the specific mechanism. The techniques I've shared with you today are specific. The 4-second inhale, 2-second hold, 6-second exhale pattern is not random. It's designed to stimulate your baroreceptors. The posture release is not just stretching. It's designed to free your diaphragm and change pressure signals. The evening reset is not just meditation. It's designed to shift your brain out of rumination mode. Specificity matters, so if you've tried breathing before and felt nothing, try again with this specific pattern. Give it a week, see what happens. What if you have very high blood pressure, 160/100 or higher? First, please talk to your doctor. That level of pressure usually requires medication to bring it down safely. But these techniques can still help you. They can lower your pressure by a few points, and those few points matter. Every 5-point reduction in your top number lowers your risk of heart attack and stroke significantly, so even a small improvement is valuable. Use these techniques alongside your medical care, not instead of it. Let me leave you with a final thought. The way we talk about blood pressure in our culture is often fear-based. We tell people that high blood pressure is a silent killer, that it's dangerous, that you need to get it under control or else. And all of that is true, but fear is not a sustainable motivator. Fear makes you act for a few days or a few weeks, and then it fades. Curiosity, on the other hand, lasts. Understanding lasts. The feeling of working with your body instead of against it lasts. So I want to invite you to shift your mindset. Instead of seeing your blood pressure as a problem to be solved or a number to be feared, see it as information, as feedback, as a conversation between you and your body. When your blood pressure is high, don't panic. Get curious. What was I doing in the hour before I measured? How was I breathing? What was my posture? What was on my mind? That curiosity will lead you to the patterns. And once you see the patterns, you can change them. Not through force or willpower, but through small, kind adjustments. You are not broken. Your body is not failing you. You have simply been living in a world that constantly asks your nervous system to stay alert, and your blood vessels have been responding exactly as they should. Now you know how to send a different signal. Now you have the tools. The question is not whether you can lower your blood pressure. The question is whether you will give yourself permission to start. Not tomorrow, not next week, today, in the next minute. So here's what I invite you to do after this video ends. Don't just click away to the next thing. Take 60 seconds. Sit comfortably. Place your hand on your belly and do one round of the baroreceptor reset. Inhale for 4, hold for 2, exhale for 6. Just one round, just to feel what it's like. That's it. That's the start. If you found this video helpful, I've put together a playlist on heart health and blood pressure that you can watch next. I'll link it below. And if you haven't already, consider subscribing to Healthwise with Dr. Narges. Every week, I create calm, thoughtful, evidence-based videos on preventive health, longevity, and the hidden mechanisms that shape how you feel every day. No fear, no hype, just clear medical insight you can actually use. Thank you for spending this time with me. Thank you for caring about your health in a thoughtful, curious way. Take care of yourself, breathe, and I'll see you in the next video.